Okay, welcome everyone to the intersection between social justice and mental health in Black communities, presented by Candace Barfield. Um, Tonight, there are a few ground rules. We hope that you stay for the entire session. We hope that you engage with the content um, and with our presenter. Few items as well is we have a raffle happening. So if you stay for 85% or more of the session, you'll be entered into the raffle to win a few grand prizes. I know some of you know that. For anyone that's new, that's good information for you. There's also a session survey at the end to give feedback to our presenter. So we hope that you fill that out as we get towards the end of the presentation. But you didn't come here to hear me speak. So I'm going to introduce our speaker, Candace. Candace has spent 6 years in the educational sector, working in behavioral intervention, social, emotional, and restorative practices field. She has worked in both charter and public education, serving as a dean and student support coordinator. As a native of Brooklyn, New York, and a product of public school education, Candace is dedicated to serving the youth in her community by providing guidance, mentorship, and support that will aid in their development of becoming a well-rounded individual. Candace also aims to continue her work with youth by offering them a platform, giving them a voice to highlight their experiences within their schools and communities, and the changes they would like to bring forth. While Candace already has degrees in criminal justice and psychology, she is currently finishing a master's degree in youth studies. Congratulations and welcome, Candace.
Thank you so much for being here. Thank you, Reshma, for the beautiful introduction. Good evening, everyone. I hope you guys are doing well. I know most of you are probably getting off of work, you're tired, so it really does mean a lot that you will be joining me here for the intersection between social justice and mental health in Black communities. And so just to go over the agenda really quickly, next slide, please. Um, the method of this presentation will be a lot of story times. So I'm going to give you a story time for myself, and then I'm going to lead the rest of the presentation by giving you the story time of a young man. So we will be looking at trauma, social justice, the intersection between social justice and mental health, how it impacts Black youth, how it impacts them during their adolescence, and then finally going into the transition into adulthood. And then we will be looking at how social justice is a health crisis for the Black community, and then a call to action, and then a couple of Q&As. I will also be stopping intermittently during the presentation because I don't want to talk at you. I actually want to have a conversation. And then I'll be asking some questions, and then, feel free to engage how you'd like. So you can go ahead to the next slide, please. You have to click one more. Forgot I put animations in here. All right, story time. So years ago, I hesitantly walked into an emergency room of a Brooklyn hospital. I did not want to go, but I had been in excruciating pain for 2 days straight. And after trying some home remedies and scrolling on Google for a possible diagnosis, please don't do that, I decided to see an actual doctor. It was pretty early in the morning and the waiting room was empty. I completed registration and that happened in about 10 minutes. And then I was given a wristband and escorted into the emergency room where I was told that I would be seen soon. So if you are a native New Yorker and have been to any hospital or a doctor's office for any reason, getting anything done in 10 minutes is like a dream come true, right? So here I am thinking it's my lucky day with how fast everything was progressing, et cetera, et cetera. And I'm laying in the hospital bed, scrolling on my phone, trying to pass the time, waiting for someone to come and see me. And at first, the emergency room only had like 3 people in it. It was like 4 a.m., right? And so only had like 3 people, and I guess that I would be seen in about the next 30 to 45 minutes tops, right? So 30 minutes ends up turning into an hour, and then an hour turns into an hour and a half, where I then walk up to the nurse's station and say, "Hey, I've been laying here for more than an hour. Are you able to tell me or let me know when I should be seeing a doctor?" And she says, "Yes, don't worry. They know you're here, and somebody would be with you soon." And that's not a definitive answer, but I was like, okay. And so I hobbled back to my bed and I lay there for another hour watching individuals who did not look like me receive care before I did. So I walked back to the same nurse and said, "Hey, I don't know what's going on, but I've been here for almost 3 hours and no one has said anything to me at all. Can you please let me know when a doctor will be able to see me?" So she immediately raised her voice and said, "For a patient in a public hospital and horrible insurance, you people sure expect luxury service. Sit down and wait." And so, needless to say, she and I had a very colorful exchange of words. And before I knew it, hospital security rushed in and confronted me about what had occurred. They too talked to me in ways that were very demeaning, disrespectful, and rude, and quite unhelpful to the situation. um I was mocked and like talked down to, and basically questioned about my whole personal life, like my occupation, where do I work, and even my ability to pay a very high hospital bill. And so I left, paid and all, because I would have rather tolerated the pain in the confines of my own home than be berated and mistreated in a place that was supposed to be taking care of me. Keep in mind that I was still sick, and after staying in the house for another 3 days, I was rushed back to the hospital where I experienced the same thing. Only this time, the doctors believed nothing I said in regard to my symptoms and my pain level. In addition to the pain, I developed this severe anxiety when it came to sharing my information with these doctors. And so I didn't trust any nurse, I didn't trust any doctor, I didn't want to share my information with people, and I had made up in my mind that I would rather suffer. And so, you know, honestly, I just didn't care to be treated differently because of my income, my occupation, my age, my race. It just wasn't ideal for me, and quite frankly, I don't think that's ideal for anybody. But since then, right, I avoided hospitals at all costs. If I don't need to go, I will not. If I can bear the pain, I will. And so while I give you a very watered down version of this encounter, the experience impacted me on various levels. And to this day, it has left a permanent and emotional scar that, you know, all my decisions moving forward are based on this. Um, and so it really impacted and shifted my view in ways for the rest of my life, right? And I always think, like, moving forward, like, I know if I look different, I wouldn't have these problems. So imagine someone saying they would rather suffer than be treated inhumanely by others. Imagine the mental state of a person to actually have to make that decision for themselves. So that's the end of my personal story. And I just want to stop there and just have a quick discussion about some of the elements of that story. Like, what are some of the things, issues that you heard? And how do you think that that experience would impact the average person? You can either unmute yourself or put it in the chat. Oh, thank you, Linda. Linda says, "As a nurse, I know your story is true, and I am deeply sorry for your experience." Thank you, Linda.
I would be so upset.
I was.
Oh my God. May I please ask, what hospital was this in New York City?
Oh my God, am I allowed to say it? I'm going to say it anyway. But it was not Interfaith. I'm sorry. Brookdale.
Okay.
And we all know I got mistaken with Interfaith because I live close to there now, but it was definitely Brookdale. But we all know,
That's a horrible hospital.
yeah.
Unfortunately, my aunt went there for something simple and passed away. But it's sad when you are discriminated against just because of your color. And it's it's just a shame. So I'm sorry that you had to experience that as well.
Yeah, no, I definitely appreciate that. And, same sentiments here. Just 2 years ago, and still fresh to this day, my father went in there for something simple and never came out, right? So, this is a very common story, more common than, people may think. Karen said, sounds about right. And Jasmine says, I would not trust the hospital system anymore. Definitely. I definitely agree. So, you know, I want to segue into trauma, right? Because that is uh, the theme of that story. And it's something that you will hear throughout the rest of this presentation. You can go to the next slide, please. And then the next one. Okay. And so, like I said, before we get into the crux of this topic, I do want you all to consider the theme of trauma, like I just said, because it's something that you will continuously hear, and it is a common theme, right? And so I also want you to kind of understand that we can't really discuss social justice without having an understanding that trauma itself is literally one of the catalysts for social justice work. So if people aren't being severely impacted and put through distressing situations, traumatic experiences, and inequitable treatment, there would literally be no reason or need for a social justice movement. And so I wanted to provide you with the definition of trauma. Next slide, please. And so the first one is a very generic definition, and it reads, a deeply distressing or disturbing experience, right? Next slide. And so the second one, this definition contains more context of the word, and it's closely associated with the topic for today. And that one reads, it's the exposure to an incident or series of events that are emotionally disturbing or life-threatening with lasting adverse effects on the individual's functioning and mental, physical, social, emotional, and/or spiritual well-being. And so this second definition really helps us to continuously connect how a social injustice is in fact traumatic and how it negatively impacts the mental health of marginalized groups, and in this specific instance, the Black community. So another question break. I just want to give you all the opportunity to kind of like share your ideas about what you think social justice actually is, just to kind of get a feel of everybody's familiarity with the topic. And so, yeah, anybody want to share or? Feel free to unmute, or you can just write it in the chat. Anyone? No? Should I just go on to my own definition? Yes? Okay, I'll go ahead and go on to my own definition here. You can go ahead to the next slide. Go ahead. That's fine. You have to click again. Okay, so I just want to say that there are three components to social justice. So one is the concept, right, which you see here, which is the fair treatment and equitable status of all people within a society, where the view is that all people deserve equal political, social, and economic rights and opportunities. Two, go ahead, click again. These are the entities that are supposed to uphold equity. Those entities are social, political, and economic institutions, as well as the laws and the policies that are responsible, again, for upholding the affordability of these opportunities. And then lastly, we have the movements, which highlight the areas of inequity and unfair treatment with the intention of being a disruptor. So now we kind of arrive here where we begin to make the connection on how social justice actually intersects with mental health. Next slide, please. Next one. And we have this sequence here, events to help explain it. And so we begin with marginalization, which is also referred to as a social exclusion. And it occurs when certain groups of people get denied access to areas of society. And then many factors can lead to the denial of access to institutions and opportunities, including historical bias, lack of funding, redlining, etc. And then you pair that with systems, policies, institutions, and laws that uphold this marginalization, such as schools, legal systems, and businesses with discriminatory hiring processes, etc. And then that ultimately leads to the continuous struggle of people within these groups to maintain wellness. And so you guys have got to understand that constantly living in a survival mode does take a toll on the brain and overall function of an individual. And something that I wanted to quickly mention, although I did not input it here, there have been various studies done on how trauma affects the brain, right? And so the hippocampus is the area of the brain that manages memory and differentiates between the past and current times. But if a person experiences continuous trauma and struggle, that part of the brain actually shrinks. And so when the brain is not able to function or regulate certain things, it just causes more issues. And that individual just finds themselves in this constant cycle of negative mental health. And so I understand that this topic can be discussed from various different angles, but today, kind of like what I mentioned earlier, we will focus on what the social injustices within the Black community looks like and give examples of how they can impact individuals through the various stages of their lives. And so we're going to start from childhood, go into adolescence, and then lastly, adulthood. Next slide, please. So, as I said, it begins in childhood. Next. And so injustice, I'll explain this slide in a minute, but injustice does not always start in adulthood, and it most certainly doesn't always involve only the things you see in the news and on Twitter, right? And so the seed is really planted during these childhood experiences. And certain childhood experiences mold and shape the trajectory of a child's life. So when these experiences are negative, if there's no proper intervention and appropriate like wraparound support, it negatively impacts a child's development and follows them all the way through childhood and then adulthood. And so if you pair that with the inequities that they may face because of their socioeconomic status or race, the impact increases. And so let's take a look at ACEs, also known as adverse childhood experiences. And so we have abuse, which can be physical, mental, emotional, sexual. We have neglect. We have physical, emotional, and mental neglect, domestic violence, incarceration of a family member, death of a family member, divorce, natural disaster, and poverty. And so now let's just take a quick look, next slide, at how they affect the different demographics. So here we have one side is Black children and the other side is white children. And so for our Black children, 1 in 3 Black children experiences 2 to 8 ACEs. So that list that I was showing you before, Black children will experience at least minimum 2 to 8, 1 out of 3. And then on the other side, 1 in 5 white children will experience 1 ACE. And so as of 2018, 61% of Black children have experienced at least 1 ACE. And then as of 2018 for white children, only 40% of white children have experienced at least 1 ACE. And then lastly, 51% of Hispanic children have experienced at least 1 ACE. You can go ahead to the next slide. Does anybody have any questions about that? Okay. No? Okay. And so the conclusion is that, traumatic experiences disproportionately affect minority children. And one of the first places in which we start to see these injustices against Black individuals is within the educational system. Next slide, please. So this topic is education and social justice and mental health. And so, next slide. So to help you visualize how this looks, we are going to be following the life story of James in his younger years. And we will take a look at how misdiagnosis, an unemployed parent, a parent with limited knowledge of state laws and the school system, the inaccessibility to appropriate healthcare resources, and being part of a system that did not prioritize his well-being led to a negative impact on his mental health. So here we go. James is very young at this point. So James is an 11-year-old African-American child who was being raised by his mother in a small apartment with 2 other siblings. His mother is a widow as his father passed away just a few months ago. While collectively they didn't make the most money, they were still able to get by because it was a 2-income household. However, once his father passed away, his mother was forced to downsize her living arrangement since she no longer had the additional funds. James watched his mother cry every day, and as she is trying to keep it together, but is truly struggling. To make matters worse, she has been fired from her job for taking too many days off for her grieving process. And when James goes to school, he is very tired and his grades have been slipping, et cetera, et cetera. He has also become very irritable and often gets into shouting matches or actual fights when he's not feeling the best emotionally or mentally. Miss Francesca, his teacher, is aware of what has occurred in his personal life, but feels it's past her professional capacity to cater to James since she has a classroom full of other students. Back at home, James's mom has been taking up odd jobs here and there just to keep food on the table and her electricity on. The school has called her multiple times to discuss James's behavior, but as you can imagine, she's never available to schedule an appointment to discuss the matters. She has agreed to allow the school to do whatever they deem necessary to help James. To relieve James's teacher of any challenges, the school has had James evaluated and has quickly diagnosed him with ADHD. This change has switched James to another classroom with developmentally delayed students. And everything that James had known to be true about school is now extremely different. And it has thrown him into like a very deep depression. He kind of feels as though people don't really see him and didn't really try to fix the situation. And so there was also an incident where James and his siblings were left home alone with their mother while their mother went on a job interview. There was a small fire that got started and the cops were called and the children were discovered to be home alone with no adult supervision, resulting in an ACS case. After this, James's mom decides she's going to quit all her jobs because she couldn't afford childcare and did not want any issues with the state. This has resulted in unemployment and further stress for everyone in the family, including James. And so again, I'm just going to pause here for question, comments. And I think while I was just telling this story, I think someone else had a question.
Yes, Cynthia had a question. Just wondering if there was any data on biracial children and the ACES. Yeah.
So that is actually a very interesting question. I'll tell you why. I studied this very heavily in undergrad, and when we start to do like all this research and like all the things that we need to do for our thesis paper and et cetera, I started to realize that it was really just looking at Black, white, Hispanic, and a little bit of Indigenous children. So from my understanding, there is not much research on how ACEs affect or impact biracial children, but I definitely think that that's something that we should consider because then that brings in a whole different type of scenario, right? So if you are mixed race, you have experiences of literally 2 different worlds, right? And so that is something that, I would like to explore further, but from my understanding, the ACEs did not include biracial children, at least the ones that I saw. Anyone else? Okay. Yes, you're so welcome. And so I just wanted to take questions, comments, and get any feedback on James's story. Did you guys see any like red flags? Like, how did you feel about James in his youth years?
I think that they just wanted to put James in that box because the teacher didn't want to take the time to help him out in his situation. The little boy was grieving, that his dad passed away. And I'm pretty sure they have resources in school for that, like a guidance counselor or something like that. And as far as the mom and her job, when she was grieving as well, and they're talking about taking too many days off,
No.
that unfortunately is a sad reality.
Yep.
I work in the mental health field as well, and I think we get 3 days for bereavement, like we're supposed to be over it in 3 days. So yeah, it's just a sad situation with the misdiagnosis and then the way that that he's just being treated now. So
Yeah.
I hate to say it, but I just see that when he gets to young adulthood and then an adult, it's not gonna be pretty good for James. And
No.
I'm gonna hush now and let you continue.
Yeah. Nope. I I agree. I agree. I know Martina had her hand raised, so I'm just going to come to you in a minute. But something that you said, yeah, you get 3 days, like literally. And again, I'm just saying this out of experience. When I was working in schools, we get 3 to 5 days. And it's just like, that's not any better, but it's like better than 3. Like, can I even just get my life together? So it's really kind of sad how people perceive the grieving process, and they don't really consider all the layers that come with it. So I appreciate that comment. Martina, are you there, Martina? Reshma, does she still have her hand raised?
I don't see her hand raised.
Oh, okay. They say that they can't unmute. Well, feel free to drop it in the chat if you if you feel like typing. And then in the meanwhile, I'll just go ahead and keep going, and then I'll just come back to your comment if that's okay. All right, so next slide, please. All right, so poverty. And I'm bringing up poverty because this is one of the themes that was in the first story of James. And so poverty is a key determinant for a child's social and behavioral development, as well as their mental health, even into adulthood. And so the fact that the mother was unable to secure and maintain employment because of the multiple things that she was dealing with, it definitely had a snowball effect on the whole entire family, right? And so this is what poverty does. It is not only scarcity, but a lack of access to resources that are able to help, right? Because, like, I forget your name, someone just said, there should have been like extra resources that both James and his mom could have utilized. Like, say, for example, in schools, they have like an employee hotline to deal with things like grief and mental health, et cetera, et cetera. So the fact that that wasn't offered, very strange. And so one of the things that I believe was an immediate red flag as well, while I was reading James's story to you, was that the school knew about his circumstances, right? But didn't extend the help or provide resources that would support James or his mom, right? And so their actions kind of seem to be tailored towards the comfortability of the staff versus the well-being of the student. And I think somebody mentioned that as well. So next slide, please. All right, so just continuing on with poverty again. There was a study done in Glasgow, right? And it was where they focused on inequalities in mental health, saying that they basically emerge really early in life and become more pronounced throughout childhood. And so in one cohort study, 7.3 of 4-year-olds in the most deprived, impoverished areas of Glasgow were rated by their teacher as displaying abnormal social, behavioral, and emotional difficulties compared to only 4.1% of the children that were not in impoverished areas. And so, like I said, this study just observed that specific area. And I just wanted to mention this because it seems as though, like in institutions such as the educational system, most adults really are not trained to or possess the skills to understand the complexities of marginalized students, right? And how their home environments actually impact their performance in school, which is something, again, that you've seen in the first story of James. So next slide, please. And so just closing out this section, in terms of poverty, we must understand, and this is just a summary of that study, and it reads, we must understand, research, and tackle stigma in a much more sophisticated way by recognizing that mental health stigma does not sit in isolation. We need to understand and address what Taran and his colleagues defined as intersectional stigma. And so intersectional stigma explains the convergence, intersectionality, of multiple stigmatized identities that can include ethnicity, gender, sexuality, poverty, and health status. And this can then magnify the impact on the person's life. Next slide. And so I just dropped these two people here. If you are interested in learning further about mental health and its intersectionality with social justice as it specifically pertains to minority children in school, you can check out one, Miss Inez Beverly Prosser, who is considered to be the first Black woman to earn a PhD in psychology. Her dissertation, named The Non-Academic Development of Negro Children in Mixed and Segregated Schools, evaluated the effects of racial inequality and racism on the development of Black children's identity and mental health. Her research and arguments actually helped lead some of the first discussions about desegregating schools in America. And then next, Mr. Joseph L. White, who is considered the father of Black psychology, he wrote the groundbreaking article Toward a Black Psychology, which is credited as being the first ever strengths-based rather than deficit-based evaluation and description of Black behavior and culture. And those articles and all their works are very important, laying the foundations of why we have these social justice movements. So next slide. So now we arrive here at adolescence. And for this section, we will be focusing on the work of Dr. Sean Ginwright. And his research basically examines the ways in which youth in urban communities navigate through the constraints of poverty and struggle to create equality and justice in their schools. And so we can go on to the next slide. And so adolescence, just some major key points here taken from Dr. Ginwright's work. It basically highlighted how the current youth development frameworks do not consider the complexities of social, economic, and political forces that impact the lives of urban youth, right? And so there's like the Cassell and like things like that. Those are the kind of frameworks that he is evaluating in his work. His work also addresses issues of racism, identity sexism, police brutality that continue to be upheld by unjust policies. Excuse me. And so, next slide, please. In the article, Toward a Social Justice Model of Youth Development, Dr. Ginwright kind of emphasizes two things, right? And so the first one, he did a study, and it was done in 1997, and it basically showed that minority youth only represented 34% of the US population at that time, but they made up 62% of incarcerated youth. Could you imagine? Like only 30, it's only a little bit, but then that is the majority of children who are incarcerated. And then two, next slide. It also talks about public policy, right? So in his works, he kind of reflected that there was a fear of youth of color, right? And so people viewed them, like the police, like different stakeholders viewed them as like menaces to society. And therefore they believed that they needed to be controlled and contained, like we're animals or something. So yeah, so we can conclude, right, that the disproportionality we see in the treatment of our children of color is not new, because this was done in 1997. Next slide. And so now we enter the adolescence stage of James, right? A few years have passed since we last heard from him. So let us see where he is during this stage. And in this section, we will be looking at how misunderstanding, unawareness of the complexities of youth of color, and systems that made no allowances of the circumstances of the youth of color continue to negatively impact James's mental health. And so James is now 15 years old, and his emotional regulation is non-existent. He doesn't have any. He has been expelled from several schools and has landed in one of the last schools in his district. This school happened to be mostly white, right? Both white students and mostly white staff and administration. All stakeholders have already coined him as a problem child, even though they have been given a summary of how he has ended up in their school. They have quite a few social workers and behavior interventionists who are able to work with him. However, none of them have been mandated to take on his case. And so in the second week, James was in the school. He went to the lunchroom for all 3 lunch blocks, and he collected food from those who did not want it and put it in his backpack to take home. He has also been seen leaving the school early without permission to go stock shelves at the local grocery store in his neighborhood. The administration confronted him about him stealing food from the lunchroom, to which he responded that, "Ma'am, sir, I was not stealing. I was given this food from my peers because they didn't want it." And he was taking it home basically to feed his younger siblings and his mom because there was barely any food available. Remember, his mom is still not working. And so they told him he would be suspended for stealing because it was against school conduct. And so, quite frankly, it made him mad. It made him mad. He became enraged, and James yelled and used profanity towards them and stormed off. Cops were called to the school, and James was arrested for petty theft and for threatening the woman on the administration. James was also not allowed to come back to the school because those same women had restraining orders against him because they felt like he was too aggressive and they didn't feel safe. So let's take a break and discuss what has happened here. Anybody has anything that they want to say about that second part, feel free to unmute or put in the chat. Oh, before somebody speaks, I'll just want to read what Martina said. She says, "This was actually what I was going to touch on in terms of poverty issues after, or another resource to help him. No need to come back to you." Okay, gotcha. Thank you. So does anybody have any comments, concerns, red flags they see about this story about James?
It's me again.
Hi.
So unfortunately, the red flag was from when he went to this last school that they said this was his last opportunity, and they kind of targeted the kid, it seems to me. And again, not providing the resources that I'm pretty sure were in the school to help him.
Yeah.
And it just seems like all of the odds were just stacked against him from the beginning. So being arrested for or suspended for the food that was given to him by the other students as well Like, I just think they were targeting him, and that probably is doing a whole lot on his mental psyche at this point.
Absolutely, absolutely agree. And I think Martina said that they definitely boxed him in. And this is where this whole social justice concept comes in, right? Because everybody deserves to have these equal opportunities to be okay, you know, physically, you know, mentally, emotionally, and like just like how in other schools, these resources will be readily available, or the community will pull together and say, hey, we got to help this kid, right? If they were of a different ethnicity and of a different like race and color, it should be the same for James and everybody like him. And so there's a question in here and it says, how do you think the inequities and lack of resources in low income schools play into cases like this? Absolutely. Kind of like what I was just saying, you can tell the schools that don't have these resources, and they kind of just push these kids along just to kind of like get them out the way, but they're not really invested. You know, in a lot of my classes and a lot of my jobs and a lot of the roles that I play in terms, like since being in education, we always talk about investment. What does it mean to look after the whole child? What does it mean for wraparound supports, right? And so, you know, at the very minimum, somebody should have been talking to him about how he felt. Somebody should be talking to him about, do you have food at home? How many siblings do you have? You can take these bag lunches. They should be connecting the mom with a social worker, something, right? But being that we are not really a priority in Black communities, we get the low end of the stick in terms of resources. So it definitely does play a big role in cases like these, because if the resources are not available, there's no way that we can provide help for the children. So thank you for that question. And so next slide, please. So we're just gonna go over Dr. Jen Wright's work as it pertains to this, and just like as a summary. So in that article, he also cites Poussin and Alexander, and it found that racist police violence, racial discrimination in employment, and unfair and racist public school practices resulted in unresolved rage, aggression, and depression and fatalism. And we saw that, right? When they accused him of something, when they were being biased against him, he was like, all right, that's how you feel about me. I'm gonna curse you out and I'm gonna walk out, right? And that is the unresolved rage, right? Because it's not really getting addressed. There's nobody really saying, listen, this really isn't the way that you should be treated, right? They're kind of just, again, just passing him through the system until it's not their problem anymore. So next slide. And so social forces such as racism, unemployment, and violence impede a productive environment. And so again, kind of just to summarize this, the expectation that kids are supposed to thrive in like environments that are very toxic, where there's unemployment, where there's violence, where, you know, there's nobody looking after them, that's a really hard thing for kids to do. Like the other slide said previously, that poverty and things like it and other traumatic experiences really do impact the development of children. Next slide. And so, kind of just like what I was saying before, there cannot be an expectation that youth who are in hostile conditions will develop healthily or properly. Next slide. And so one of the things he found was that racism has contributed to high rates of stress-related illnesses in the Black community. And that one was not just for children, but it was for all Black individuals, the entire community, because a stressor really definitely impacts the way you are able to move and navigate throughout your life, in your everyday life. And just imagine always being stressed out at home, at work, at school. It really does take a negative toll. Next slide. And so just summarizing with these last three main points in his work. One, the lives of minority youth must be conceptualized holding that political, economic, and social landscape is a place where they and their families struggle for economic survival, sustainability, and mobility. And so basically he's saying all the stakeholders have to realize that the world that they live in plays a really big role in how they are able to develop, and it's not an easy space for them to be in. Number two is to recognize that minority youth define, negotiate, and really struggle for their identities in oppressive environments. So again, every day they're fighting at home, in their communities, on public transportation, in school, and it really is an issue that needs to be addressed. And then lastly, exploring how, with a social justice lens, the ways to respond to forces that deem them powerless and generate ways to contend with larger political forces. And so basically, he's just trying to find a way where we're not causing any more harm. We're not telling them to like just go out and rebel, but to kind of understand the situations that they're in, the systems that were not made for them, and how they could learn, get this knowledge, and then go out and try to make a change for themselves and their community. And that's what he thinks that the framework should encompass when we are talking about youth development. Next slide. And so lastly, we are going to end with James as an adult. And so next slide. Now James, he's an adult, right? And so we're going to look at how the continued cycle of poverty, untreated mental health issues, and a lack of steady employment and systems, and how the systems that uphold inequity have continued to negatively impact his mental health. And so now he's 23 years old, and he has been in and out of prison, remains unemployed, and lives in a New York housing project building with the rest of his family. James doesn't really have a plan for his future, nor does he really care. He goes through these like really depressive states and bouts of anxiety for months at a time, and it really has impacted his ability to be a normal functioning adult. Even though he has tried to secure employment, by the time he reaches the background check part, he knows he will not get the job because of the record he had, including all the times he's actually stolen from stores to feed his family. Sometimes he toys around with the idea of receiving professional mental help, but his fears of what they did to him as a teenager prevent him from taking the next step. The education and legal system have essentially failed James. And so unfortunately, like someone said, it was not going to end well for James. And this story is very, very common for Black individuals right here in the United States, just New York alone. The marginalization of people of color and how that impacts their whole entire lives has become so perverse and should be considered a health crisis, which we're going to get into next. Next slide. So social justice as a health crisis for Black people. Next slide. So some of these facts that I collected. The first is, according to the Health and Human Services Office of Minority Health, Black adults in the US are more likely than white adults to report persistent symptoms of emotional distress, such as sadness, hopelessness, and feeling like everything is an effort. Kind of like how when you, I don't know if some of you hear or see on TV, where there's like the fact said, there's a lot of hopelessness and like just feeling like they can never climb out of the hole that they're in. And that is sadly, again, the reality for a lot of Black people in our community. Next slide. This one says that Black adults living below the poverty line are more than twice as likely to report serious psychological distress than those with more financial security. And so again, we come here with this common theme of like, we all know that there's a pay disparity and a very big pay gap between Black people and non-Blacks, right? Non-colored people. And so that definitely plays a part in, you know, how they navigate throughout their lives. So say, for example, a Black person who has went to school, has accumulated all these degrees, and he has a white colleague who probably only got one, or maybe the same, who knows? It could be equal. They both have 2 degrees. And however, the salary would look really different. And when your salary doesn't look right, that means that your living situation will also be impacted. And so again, just holding poverty as a very major component of mental health problems within the Black community, because their sentiments basically are they're just trying to survive. But again, the institutions that are supposed to be upholding equity, they don't, right? So places of employment, schools, legal systems, et cetera, et cetera. Next slide. And so before I read this here, I'm just going to read a small blurb from an article from Columbia's University, their psychological department. And it's a more recent article. It was published in 2019. And it reads, the Black community suffers from an increased rate of mental health concerns, including anxiety and depression. The increased incidence of psychological difficulties in the Black community is related to the lack of access to appropriate and culturally responsive mental health care, prejudice, and racism inherent in the daily environment of Black individuals, and historical trauma enacted on the Black community by the medical field. Moreover, given that the Black community exists at the intersection of racism, classism, and health inequity, their mental health needs are often exacerbated and mostly unfulfilled. And so I just want to end with this quote, and it reads, there is no separation between oppression and mental health. Next slide. And so I am going to pause and just get everybody's feedback before I read these 2 bullet points of call to action. Does anybody have any feedback, any questions, comments, experiences they may want to share? Anyone? That's fine. So I'm just going to read these call to actions. Or questions that you can answer that will help us develop a call to action. What tangible actions can we as advocates, youth workers, et cetera, do to interrupt systems that uphold inequities? And then the other one is, how can we continue the fight towards creating a socially just environment for Black communities? Martina, are you able to unmute, or do you want to put it in the chat? I think they have to put it in the chat. So we'll just wait on Martina's response. In the meantime, anyone else? Cynthia?
I think just doing what you're doing right now definitely like helps us get closer to that point. Having these discussions and having these discussions often definitely brings it out to the world, to the society, period. So I thank you for this.
Thank you. Thank you. You're so welcome. Yeah, I definitely am a person who's my whole life's work is definitely being passionate about giving the children what they need, because I forget who said it, but it's better to help a child while they're a child than try to fix a broken man. And so the interruption and the support starts in childhood and youth work. So thank you.
Thank you for sharing your experience.
Thank you. Thank you. Anyone else have any comments, concerns, feedback? No? All right, well, if no one else has anything, Reshma, do you have anything to add or?
Nothing to add to the presentation, just a thank you.
Thank you. Thank you, Kimberly.
Yeah. I think somebody put something in the chat. I'll just.
Yes, that is so true. That is so true. Viviana says, I would like to point out that we sometimes experience racism and unequal treatment from our own people. And it's not just about Black and white anymore. You are absolutely right. And if I had a lot of time, I would have included that too. Because as you know, if we see something that's happening, we should not turn a blind eye, which a lot of the times we do. And we just have this attitude as, oh, it doesn't involve me. It's not my child. Or, you know, I don't want to, you know, be nosy. I don't want to do this. I don't want to do that. And we don't realize that by you being neutral is you actually enabling the wrong thing that's happening. So I definitely agree. And I'm glad that you brought up that point.
I have a question for you, Candace, and if you've done any research or read anything on the myth of the American dream and its impact on like self-victimization and internalized racism.
No, I have not read that, but one of my favorite things to do is read. So offline or in the chat, can you drop that for me? Because that sounds very interesting.
Yeah, sure. I can also email you after.
Yes, absolutely. Courtney?
So, and also I just want, as a youth worker, I just wanted to add that on top of experiencing racism, discrimination, stereotyping, and all that from your own race of people, as youth workers, we also have to unlearn everything that society has taught us about, especially if we work with underprivileged minority children. We have to unlearn that they are more worse than other kids or they deserve to be in this predicament. We have a lot of unlearning to do ourselves as adults because society has literally fed us these lies and stereotypes our whole lives. And then we go into working with kids and the situation is not ideal and the children might not be the ideal child that you learn in school to deal with. And automatically, sometimes we revert back to those thoughts like, oh, these kids deserve this, or oh, this is why they're like this. So we have to really do our due diligence as youth workers to unlearn these things so we can really take our time and use our education to really figure out what's wrong with these kids and really give them the support they need.
Absolutely, 1000% agree. It's one of those things where other people, it's the type of lens you're using to look at these children. Where you see bad behavior and a child that doesn't listen, I see that child doesn't get attention at home. They're neglected. I see trauma, right? And so, yeah, I definitely agree that we have to shift the lens that we are using when we are dealing with these children. Thank you so much for bringing that up. And Martina said, thank you for doing this. The need for more advocates is amazing. If we could change the stigma in each other, we could, absolutely. If we can change the stigma in each other, we can do a world of good. I agree. She says, I'm sorry, I can't unmute for some reason. No worries. More programs are needed in all areas where it's not just targeting one group, but all groups / races. 1000% agree. And so, yeah, any other comments, questions, anything like that? And yes, absolutely compliments to Courtney for the work that she's doing. All righty. Well, thank you everyone for joining and staying on with me and listening to my story times. I appreciate you all and have a wonderful, amazing, and safe Friday and weekend.
Thank you, Candace, for your vulnerability and for a thoughtful and well-organized and engaging presentation on a topic that I might say is relevant and eye-opening. Thank you to those who attended and participated. We hope that it was a worthwhile session. The Student Leadership Committee would like to hear from you, and I'm sure Candace would like to hear your thoughts as well. So I'm going to drop a link for a survey in the chat. If you can please fill that out, we would really appreciate it. We hope to see you at other sessions. Our last session is actually tomorrow at noon when they see us surrounded microaggressions. So I think that would be a great follow-up to this session as well. Thank you again, Candace. A wonderful job.
Thank you. Thank you so much. Have a good one.
You too. Bye.